Hello, everyone. My name is Sobrevia, and today I will be presenting my community health project focused on promoting hand hygiene among fifth grade students in the Washington Heights neighborhood of Milwaukee, Wisconsin. Community health nursing aims to improve population health by addressing environmental, behavioral, and systemic factors. This project focuses on a school-based intervention to reduce communicable disease transmission through improved hand hygiene. Washington Heights is a well-established urban neighborhood located just west of downtown Milwaukee. Although small in land area, the neighborhood is rich in culture, history, and community pride. It features tree-lined streets, architecturally significant homes, and a highly active neighborhood association that promotes safety and unity. The area includes a mix of small businesses, green spaces, and public transportation options, contributing to the overall livability and accessibility of the neighborhood. The population of Washington Heights is approximately 6,591, with the demographic making up that is primarily white, about 62%, though the community does show increasingly cultural diversity. The climate features four distinct seasons, which can influence seasonal health needs, especially in school-aged populations. Politically, the area leans Democratic in alignment with the broader urban Milwaukee. What makes Washington Heights particularly suitable for a community health project is the strong civic engagement and educational infrastructure, such as schools like St. Sebastian Catholic School. These attributes offer a supportive environment for implementing educational health interventions and achieving meaningful outcomes. Washington Heights is a residential area located on Milwaukee's west side. It's a neighborhood that really stands out compared to some of the more crowded and struggling parts of the city. The homes here are mostly single-family and duplexes built in the early 1900s. A lot of them are in great shape, with well-kept yards and beautiful architecture like Tudors and colonial styles. Their streets are clean, lined with trees, and there are sidewalks throughout, what makes the neighborhood very walkable. Along main streets like North Avenue and Vliet Street, you'll find small local businesses like cafes, barbershops, and boutiques. There are also churches, libraries, and the Washington Heights Neighborhood Association, which helps keep the community connected. Washington Park is a big draw here too. It has trails, a playground, and a pond, and it's popular for walking, biking, and family activities. Public transportation is available, but many residents also drive. There are bike lanes and traffic calming features that make it safer for cyclists and pedestrians. Crime is low compared to other Milwaukee neighborhoods, and people here generally feel safe. There's also a strong sense of community with things like neighborhood watch programs and local events. Even though it's not the most underserved area in Milwaukee, Washington Heights still has its own unique needs and strengths, which is why it's important to look at neighborhoods like this in a community health project. Although there isn't a lot of specific data just for Washington Heights, looking at city-wide stats from Milwaukee helps give us a solid picture of the overall health and social needs in the area. Milwaukee is a diverse city with around 38% of the population identifying as Black, Washington Heights, on the other hand, is known to be mostly white, about 62%, but there's still a mix of other racial and ethnic groups in the neighborhood. From 2019 to 2023, nearly 16,000 veterans were reported living in Milwaukee. That highlights the need for local veteran services and health care. Also, although about 23% of the city's residents live below the poverty line, while that number is likely to lower in Washington Heights due to higher incomes, it's still important to consider when assessing community needs. Health insurance is another big factor. About 10% of Milwaukee residents are uninsured and nearly 40% rely on Medicaid. That shows how essential public health programs are, even in areas like Washington Heights that are closer to major hospitals like Froedtert, Ascension, and Advocate Aurora. There are also important considerations for seniors. Over 10% of the residents are aged 65 or older in the city live with 65 and older in the city live with a disability, which means accessible housing and senior services are crucial. As for nutrition, WIC services are used by over 87,000 people in Milwaukee, which may reflect food insecurities in some areas, even if it's not as visible in Washington Heights. When it comes to education, about 85% of adults in Milwaukee have finished high school, but only around 27% have a bachelor's degree or higher. While we don't have specific numbers for Washington Heights, schools like St. Sebastian provide quality education to many families in the neighborhood. The city's unemployment rate is around 3.6%, which shows that people are working, but chronic health issues like heart disease and diabetes are still more common in lower income areas, especially where access to preventive care is limited. As community health nurses, this is where we step in. We need to push for policies that support equity, provide cultural appropriate care, and focus on education and outreach. Things like health screenings, building partnerships with local groups, and improving health literacy can make a real impact. When we look at younger populations, unintentional injuries are still the leading cause of death under age 25. And in terms of maternal and child health, Milwaukee reported over 11,000 live births county-wide in 2023, with 89 infant deaths the year before, many due to SIDS or SUDI. These are preventable outcomes that community health efforts can help reduce. Strong partnerships are vital for the success of any community health initiative. For this project, I collaborated with St. Sebastian Catholic School, specifically Dean of Students, Miss Melinda Renault, who helped coordinate logistics and communication with the fifth grade teaching team. Her role in supporting students' physical and emotional health was essential. In addition, several community organizations were identified that align with St. Sebastian's mission. Milwaukee Recreation provides wellness and enrichment programs for youth, which could support hygiene and reinforcement activities. The Hunger Task Force ensures families facing food insecurities receive nutritious food, essential for student health. Junior Achievement offers programs that build decision making and personal responsibility, which completes hygiene education through self-care promotion. These organizations can extend the reach of school-based interventions and ensure sustainability beyond the classroom. So in the top left corner, we have a picture of St. Sebastian Catholic School at the angle of the actual church. St. Sebastian Church behind connected is actually the school. You have on your right to St. Sebastian School um, the Hunger Task Force. So they collect food, they donate food, and they spread it around. They stock shelters, they stock food banks, so they're all one-stop shop for food nutrition. Junior achievements down there in the left lower corner, advertisement. And if you were looking for recreation, that is the Milwaukee Recreation Guide at the bottom, where all things recreation and family enrichment programs you can find throughout the city of Milwaukee. The community health diagnosis is the risk of infection among fifth grade students at St. Sebastian Catholic School due to insufficient hand hygiene practices. This diagnosis was supported by both observational data and input from school leadership. Several factors contribute to this issue. Students often have limited time between activities, making it difficult to practice thorough hand washing. There is also inconsistent modeling of proper hygiene by adults and lack of student awareness regarding when and how to wash their hands. Although hand, although hand sanitizer is distributed before lunch, there is no formal hand hygiene curriculum in place to reinforce these behaviors. In some school areas, insufficient access to hand washing stations or supplies further complicates the issues. Without consistent education and access, students are more likely to skip hand hygiene, which increase the risk for the spread of communicable diseases such as colds, influenza, and gastrointestinal infections. Addressing this gap through interactive child-centered education is both timely and necessary to protect the health of the student and reduce preventable absences. The Community Health Plan outlines a focused strategy to improve hand hygiene behaviors among fifth grade students. The plan is guided by SMART: objective, specific, measurable, achievable, relevant, and time bound to ensure targeted outcomes. The short-term goal is that by the end of this educational session, students will demonstrate improved knowledge of when and how to wash their hands. This includes recognizing appropriate times for hand hygiene, understanding the minimum duration of 20 seconds for proper hand washing, and identifying when hand sanitizer is an acceptable alternative. The long-term goal is to achieve a measurable decrease in illness related to absence over the following 6 months. While data will be collected informally through staff and attendance records, a downward trend in communicable illness cases will signal success. This plan not only reinforces individual behavior change but also supports broader public health goals in preventing disease transmission within school environments. The intervention implemented was an engaging, hands-on educational session tailored to fifth grade students. The session began with poll-style questions to assess prior knowledge and getting students thinking about when and how they wash their hands. Then students watched a short, age-appropriate educational video that visually demonstrated germ transmission and proper hand washing techniques. A key component of the intervention was the glow germ demonstration. Students applied glow germ lotion, washed their hands using either soap or hand sanitizer, and then viewed the results under a black light. This allowed them to see areas they missed, reinforcing the need for thorough technique. Students also participated in a group comparison activity, observing which method, soap and water versus hand sanitizer, was more effective. This activity supported kinesthetic and visual learners while encouraging discussion and curiosity. The intervention supported multiple learning styles and created a fun, memorable experience. According to Healthy Schools, Healthy People, interactive instruction improves hand hygiene compliance and retention in children. This is a brochure that I made that was giving to the children entitled The Power of Clean Hands. It had information about hand washing steps, why we should wash our hands, when we should wash our hands, a few fun facts, and some information about good germs and bad germs. And then something, most of that, geared towards parents, and then something fun to get the kids to want to read the brochure. I added some games. There's a words unscramble, and also like a connect the dots situation where they can connect the steps um, with when they should be done appropriately. So they seem to like that. They're excited about that. Activity sheets were also given to the children to take home. These sheets were in addition to the glow germ kit I purchased. I was able to make enough copies for both the students and the teachers. So first they were like, "Is this homework?" But when I told them no, then they got excited, like, "Oh, okay, yeah, well this is cool. Yeah, I'm gonna do this." So they started to try to like unscramble the words before I even left. So that was pretty cool. Evaluation is an essential step in determining whether a health education intervention has been effective. For this project, both formal and informal methods were used. Pre and post session polls were conducted to assess changes in the students' knowledge. Results showed a clear increase in awareness regarding when to wash hands, how long to wash hands, and when it is appropriate to use hand sanitizer. Another valuable form of evaluation was direct observation. During the Glow Germ activity, students were able to apply what they learned in real time and were eager to improve after seeing areas they missed. Under the black light, this hands-on feedback loop helped reinforce correct behavior. Informally, feedback from teachers and staff indicated that students were more attentive to hand hygiene after the session. Teachers also observed students reminding one another about proper hand washing techniques in the classroom and lunchroom. These early indicators suggest that the intervention was effective in meeting its short-term objective. Continued reinforcement through staff and parent involvement will be important for sustaining these behaviors over time. There you have a picture of me with one of the students. They especially love this glow germ demonstration. It was so much fun. In conclusion, this community health project focused on addressing an often overlooked but highly impactful topic: hand hygiene among school-age children. Through a detailed community assessment, we identified Washington Heights as a suitable and engaged neighborhood and selected St. Sebastian Catholic School as an ideal partnership site. We identified a clear health need: improving hand hygiene to reduce the risk of infection, and developed an interactive, evidence-based intervention. Our efforts were supported by school leadership and tailored to be age-appropriate, engaging, and educational. Early outcomes show improved student knowledge, strong engagement, and promising signs of behavior change. This project underscores the value of school-based education in promoting public health and highlights how nurses can be key leaders in these efforts. Moving forward, we must continue to advocate for preventative care, strengthen partnerships, and involve families to reinforce healthy habits across communities. And thank you so very much for watching my presentation. Hope you guys enjoyed it.